In our morning rounds, how the connection between your head and heart could damage your health. New research suggests middle-aged and older women who face major stress increase their odds of a heart attack by 65%. Our Dr. Tara Narula is a cardiologist at Lenox Hill Hospital in New York. Tara, good morning.
Good morning, Nora.
Okay, what kind of stress are we talking about, major stress?
Right, so the researchers looked at different types of stress, whether it was financial, employment, marital infidelity, death, or loss of a loved one. So they really covered a lot of different types of stressors. And what they did is follow 500 women for over 9 years who were middle-aged in their 50s. They broke them down into two categories, 267 who had a heart attack and 281 who didn't. And then they looked to see if there was an association between any of these stressors and the risk of a heart attack. Essentially what they found is three big things. One was that if a woman's income was less than $50,000 a year, they were particularly vulnerable to having stressors impact their risk of heart attack. If they had financial troubles, they were at double the risk of a heart attack. And if they had what researchers called a traumatic life event, which would be a life-threatening illness, death of a loved one, like a spouse or a child, or had suffered some sort of physical assault, they were at a 65% increased risk of heart attack. And these weren't just recent events, but could have been distant past prior events.
Do women talk to you about stress? Do you ask your patients about stress?
You know, the interesting thing is when they come to the cardiologist, they don't often bring it up unless they're having some symptom of chest pain. But then when you ask them, which I do, it's like the floodgates open. And yes, I'm under stress from my family, my job, everything. They carry a lot of stress around every single day. And I think one of the big things of this study and researchers try to point out is that as doctors, we need to really be better about asking our patients about this. And patients need to recognize that this is as big a risk factor as the things they know about, like blood pressure and cholesterol and diabetes.
So what is it stress does to the body that causes a heart attack?
Stress does a lot of horrible things, but what it does is it increases the blood pressure, it increases the heart rate, it can constrict the blood vessels in the body, it increases inflammation. So if plaques are stable, it can disrupt them, which can lead to a heart attack. And then it increases, or a stroke, it increases your risk factors because you don't sleep, you eat poorly, you might drink or smoke. So it has very negative effects in a lot of different areas.
Did the results of the study surprise you? Because doesn't it stand to reason that if you've had a traumatic event, it could definitely be stressful and lead to a heart attack?
Certainly. I think what was different about this study is that most of the prior research has been on men or people who had prior heart attacks. So this study really focused on women. And this is really an evolving area for us, is understanding how gender interplays with cardiovascular disease and stress. And we're not sure yet if women are physiologically different. Some research suggests that our response to stress is different, so that a man might raise his blood pressure or heart rate, a woman might constrict her blood vessels instead. But we don't know. Do women increase the levels of stress hormones when they're under stress? Do they react to stress differently by internalizing as opposed to expressing their stress? Do they turn on the stress response more often? Are they under more stress because they're caregivers a lot of times? So a lot of unanswered questions.
Yeah. This is something we need to pay attention to.
Absolutely.
Thank you, Dr. Tara Narula. Good to see you.
You too.